Hi, Dawn Stensland-Menti, live today on The Dawn Show. We are talking about a mega movie star, your boobs, and the risk of cancer. My first guest, top surgeon Dr. Kristen Brill of Cooper Cancer Institute and the Janet Knowles Breast Center. It's so good to have you here.
Thank you for having me.
So, and I should say that we're talking about breast and ovarian cancer because we're talking about Angelina Jolie making this public, being criticized, which is bizarre to me. But I would imagine that for doctors at Cooper and for surgeons like you think, yay, awareness, this is a good thing.
Yeah, this is what we support and fight for every day. I think part of what we do as breast cancer specialists and cancer specialists in general is not only assessing a woman's current status, but what her risk is, what her genetic risk is for cancer. So I think the fact that Angelina has come out having made this very brave decision really is a very admirable one.
And we'll bring in a geneticist, and we have three awesome Cooper doctors actually who are experts and even their family history and motivations in this issue. This is big stuff. And in my family, I should say, you know, my grandmother, my mother's mother, was a breast cancer survivor, had a mastectomy. Her mother was a breast cancer survivor. So awareness in the family, in my family, even of women from back in the day, that awareness saved lives in my family. So anytime I can talk to you about this and bring on wonderful surgeons like you, Dr. Brill, I want to do that because this is life-saving stuff.
Right, right. It's interesting. Some women find that as they delve into their family history, older generations are not so open. It was not talked about if a woman had cancer, and it wasn't always a definite fact. You know, it's hard to find pathology reports and find really definitive information. But I think beginning to ask is important, and identifying age of diagnosis for both breast and ovarian cancer is important. I think it's also important to know, though, most women who have a family history of breast cancer, particularly those breast cancers that occur later in life, maybe the 60s or 70s, those are not typical family histories for BRCA mutations. Not that it can occur, but the BRCA mutation still is not that common.
That's when you have that cancer gene like Angelina Jolie did that tells you, well, you have up to an 87% chance. Of course, her mom died in her 50s of ovarian cancer.
Well, it's actually about an 87% chance of lifetime chance of breast cancer. And for that particular mutation, nearly a 40 to 50% chance for her for ovarian cancer.
So for her, it was with kids and a family and all of that.
Right.
You know, I think it was a no-brainer. Did it surprise you that some people were critical of her for either coming out and talking about it, or just critical in general? Why would she do that? That's stupid.
It does a little bit, but not entirely. We still find it's a frightening topic for many, and so we have women who come in through the office with a pretty compelling family history for being a BRCA mutation carrier. And still that decision on to test, do I want to know, is a really challenging one. And for women mothers who have a mutation and have daughters, there can be guilt and other issues associated with it. So it's a very complex issue.
Yeah, see, now in my family, I grew up with, again, my grandma Virginia, who was diagnosed in her 50s, and her mother had that battle. And so she had one breast removed, did not do any kind of, and she'd say, oh, the headlights are crooked. And, so we're a very open family, and she was open about it. And to me, I think, in a way, that's great that she could be open about it.
Yeah.
But for a lot of women to think about, a breast, that's a primitive thing. It's babies, fertility, your womanhood, are you sexy? This is deep emotional stuff.
And remembering that the group of women we're really talking about earlier breast and ovarian cancer. So we're talking about women maybe in their late 20s, in their 30s, in their 40s. And these are all really top priority issues. So to have a young woman who is maybe in her 30s and hasn't made definitive decisions about, say, career or children or family, to make big decisions about preventative surgery can be a very daunting one.
Yeah, I mean, I think, because for me, I was, career woman, not married until I was 35 years old. So there are women you're saying that you see in your office who come in at the early 30s, 35, even 40, career women,
right.
And they're thinking, wait a minute, I want to have kids or that sort of thing.
Right.
So for Angelina Jolie, for somebody who does that preventative situation where they have the gene, is it better then to preserve the breast because she's not, in essence, putting the fire out. She doesn't have the full-blown cancer.
It changes everything in the sense that we are no longer watching or surveying for breast cancer formation, but actually preventing it. So it's an entirely different avenue that she's taken. Some women opt not to do any prophylactic surgery with a mutation, and so we'll watch them closely with breast exam, breast mammogram, MRI of the breast.
So do they go, folks like that, do they go more than once a year?
So they'll have a clinical breast exam by a doctor, typically twice a year, and then typically screened with mammogram, MRI. And you can imagine when we have a lower threshold for biopsy and we're watching these young women closely who tend to have dense tissue and busy breast tissue, it can lead to this roller coaster of exams, biopsies, repeat exams. And sometimes a couple of years of that pattern, women will say, I now am making a decision to do something prophylactically because I don't want to do all the surveillance.
But if I were your patient and I had this gene and I had made this decision, I mean, somebody, I imagine Angelina Jolie or any mom or any woman would say, how good are they going to look?
Yeah, and that's what's changed entirely. The reconstructive options are entirely different, even in the last 10 years. So we're talking to young women about reconstruction using implants, which is usually a 2-stage procedure, can be one, but typically 2. The really beautiful reconstructions that a woman might be a candidate for is using tissue from her own body, maybe the fat pad on the belly or elsewhere. So there are really beautiful reconstructions, and there are often opportunities to save the skin and or nipple. So we try and create as real a result as possible.
And that's what a lot of people don't realize. Stay right here. We have 3 awesome doctors who are going to be giving us great advice. And by the way, if you have questions for our doctors, there's the number, 866-472-8868. You're watching The Dawn Show live, and our conversation continues right after this.